The top 14 uses of magnesium. Magnesium is second only to potassium in terms of concentration within the individual cells of the body. The functions of magnesium primarily revolve around its ability to activate many enzymes. Magnesium deficiency is extremely common in the geriatric population and in women during the premenstrual period. Deficiency is often secondary to factors that reduce absorption or increase secretion of magnesium, such as high calcium intake, alcohol, surgery, diuretics, liver disease, kidney disease, and oral contraceptive use. Signs and symptoms of magnesium deficiency include fatigue, mental confusion, irritability, weakness, heart disturbances, problems in nerve conduction and muscle contraction, muscle cramps, loss of appetite, insomnia, and a predisposition to stress. Here are the top 10 uses of magnesium. 1. Asthma and chronic obstructive pulmonary disease. Magnesium promotes relaxation of the bronchial smooth muscles. As a result, airways open and breathing is made easier. 2. Attention deficit disorder. Magnesium deficiency may play a role in attention deficit disorder, as research indicates many children with attention deficit disorder have lower levels of magnesium. 3. Cardiovascular disease. Magnesium is absolutely essential in the proper functioning of the heart. Magnesium's role in preventing heart disease and strokes is generally well accepted. In addition, there is a substantial body of knowledge demonstrating that magnesium supplementation is effective in treating a wide range of cardiovascular diseases. 4. Angina. Magnesium supplementation, most studies have used intravenous administration, has been shown to be helpful in angina due to either a spasm of the coronary artery or atherosclerosis. The beneficial effects of magnesium in angina relate to its ability to improve energy production within the heart, dilate the coronary arteries resulting in improved delivery of oxygen to the heart, reduce peripheral vascular resistance resulting in reduced demand on the heart, inhibit platelets from aggregating and forming blood clots, and improve heart rate. 5. Cardiac arrhythmias. Magnesium was first shown to be of value in the treatment of cardiac arrhythmias in 1935. More than 60 years later, there are now numerous double-blind studies showing magnesium to be of benefit for many types of arrhythmias, including atrial fibrillation, ventricular premature contractions, ventricular tachycardia, and severe ventricular arrhythmias. 6. Congestive heart failure. Congestive heart failure refers to an inability of the heart to effectively pump blood. Congestive heart failure is most often due to long-term effects of high blood pressure, a disorder of a heart valve, or a cardiomyopathy. Magnesium levels appear to correlate directly with survival rates. 7. High blood pressure. There is considerable evidence that a high intake of magnesium is associated with lower blood pressure in population studies. Because of this evidence, researchers began investigating the effect of magnesium supplementation in the treatment of high blood pressure. The results from double-blind studies have been mixed. Some of the studies showed a very good blood pressure lowering effect, others have not. Magnesium appears most helpful if an individual is taking a diuretic or has a high level of renin, an enzyme released by the kidneys that eventually leads to the formation of angiotensin and release of aldosterone. These compounds cause the blood vessels to constrict and the blood pressure to increase. The degree of blood pressure reduction with magnesium is generally modest. 8. Diabetes. Magnesium is known to play a central role in the secretion and action of insulin. Several studies in patients with diabetes or impaired glucose tolerance have shown magnesium to be of value. Magnesium supplementation, usually 400 to 500 mg per day, improves insulin response and action, glucose tolerance, and the fluidity of the red blood cell membrane. In addition, magnesium levels are usually low in diabetics and lowest in those with severe retinopathy. Diabetics have higher magnesium requirements and need dietary supplementation to meet that need. 9. Fatigue. An underlying magnesium deficiency can result in chronic fatigue and symptoms similar to chronic fatigue syndrome. Low red blood cell magnesium levels, a more accurate measure of magnesium status than routine blood analysis, have been found in many patients with chronic fatigue. 10. Fibromyalgia. Fibromyalgia is a recently recognized disorder regarded as a common cause of chronic musculoskeletal pain and fatigue. One study demonstrated that a daily supplement of 300 to 600 milligrams of magnesium, as magnesium malate, resulted in tremendous improvements in the number and severity of tender points. 11. Kidney stones. Magnesium increases the solubility of calcium in the urine, thereby preventing kidney stone formation. Supplementing magnesium to the diet has demonstrated a significant effect in preventing recurrences of kidney stones. 12. Migraine and tension headaches. There is considerable evidence that low magnesium levels trigger both migraine and tension headaches. In individuals with low magnesium levels, magnesium supplementation has been shown to produce excellent results in double-blind studies. 13. Pregnancy, toxemia, premature delivery, and other complications. Magnesium needs increased during pregnancy as reflected from an increase in the RDA from 280 mg to 350 mg per day. Magnesium deficiency during pregnancy has been linked to preeclampsia, a serious condition of pregnancy associated with elevations in blood pressure, fluid retention, and loss of protein in the urine, preterm delivery, and fetal growth retardation. In contrast, supplementing the diet of pregnant women with additional oral magnesium has been shown to significantly decrease the incidence of these complications. 14. Premenstrual syndrome. Magnesium deficiency has been suggested as a causative factor in premenstrual syndrome. While magnesium has been shown to be effective on its own, even better results may be achieved by combining it with vitamin B6 and other nutrients. Several studies have shown that when PMS patients are given a multivitamin and mineral supplement containing high doses of magnesium and vitamin B, they experience a better reduction in PMS symptoms compared to the results seen in studies with magnesium alone. This is all in this video. Do not forget to subscribe to continue receiving information. Also, do not forget to download your bonus in the description link.